Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. Before we dive into this powerful episode, please remember to subscribe to our channels and give us a 5-star rating on iTunes to continue hustling. This episode is brought to you by Excite Medical and the DRX 9000, Peach State Payments, Recover, Chiro HD, Softwave, Cool Blue BA, Chiro Health USA, Chiro Script AI, Chiro Moguls, The Chiro Speaking Company, Pure Chiro Notes, 5-Star Forge, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, and the IFCO. You can benefit from our full list of sponsors by visiting the sponsor page at chirohustle.com/sponsors. Links in the description. Now, let's hustle.
Hey guys, welcome to episode 667 of the Chiro Hustle Podcast. I'm your producer, Luke Millette, and here's your host, James Chester.
So today we had the opportunity of interviewing Dr. Steve Troyanovich. And if you want to hear our conversation about becoming a cultural authority and his new book, The Human Touch, stay tuned for the full episode. Welcome back. This is another episode of the Chiro Hustle Podcast. I have Dr. Steve Troyanovich with me today. Really excited to have him in. He's out there in the middle of Illinois, and I'm out here in beautiful Grand Junction, Colorado. And really excited to have him on today. He just wrote a book that was released called The Human Touch. Want to send a big shout out to Todd Waters with the Chiropractic History Facebook page for bringing us together. Thank you, Todd, for doing that. Dr. Steve went to Palmer College of Chiropractic in Davenport, Iowa, my hometown. So I know his old stomping grounds where he went to chiropractic college. But we're going to talk about his book. We're going to talk about cultural authority in chiropractic, and we'll talk about belief in chiropractic. At one point, he wrote a newspaper article about the belief in chiropractic, and I'm sure we'll touch on that. But now Dr. Steve is retired from full-time practice, and he is focused on different parts of the chiropractic profession. And I'm excited for this interview. But before we get into Dr. Steve's story, I'm going to tell you our big why. Why do we do what we do over here at Chiro Hustle? Well, first things first is freedom of speech. I know how valuable that is to us as a culture. So we've never censored anybody. We've never edited anybody's messages. We just let people talk. And that's what makes us very unique in this podcast space is we do create great content from great guests. So I'm thankful for being able to do that. We believe in medical freedom also and family health freedom. If you don't know what those are, find yourself a local chiropractor, go knock on their door, show up and say, hey, I'm here for that medical health stuff. I'm here for that health freedom stuff. And I'm sure you're going to surprise that chiropractor, but they'll be thankful to have you. We also get a bit more philosophical. We believe in protecting the sacred trust. If you guys don't know what that is, it's BJ Palmer's last words. Click on the show notes inside of our episode, and you're going to find out more about chiropractic than you ever did before, I guarantee you, because this profession is science, philosophy, and art. We also believe in subluxation centered chiropractic. I know I shouldn't have to say that to a room full of chiropractors, but they're removing this contextual conversation from chiropractic colleges. So if you have ties to a chiropractic student or a young DC, please share the show with them so they can start to understand the real deal philosophy of chiropractic. And closing on the intro, we also believe in innate intelligence and universal intelligence. We believe that when man or woman, the physical gets adjusted, it connects them to man or woman, the spiritual, which actually connects to the educated intelligence. I know there's a lot there, but that is the introduction to our Chiro Hustle Podcast, episode 667. Dr. Steve.
Hello.
Welcome to the show. Welcome to the show. Thanks for being with us.
Thanks for having me. Hey, I got to do something or my chiropractic history nerd friends will be upset with me. So I used to be the editor of Chiropractic History. This right here that I'm showing you to the camera is the last known photograph of BJ Palmer. He was dying from colorectal cancer. He was at his winter home in Sarasota, Florida, and he died on May 27th, 1961 at 8:45 in the morning. So Those are his last written words that you're referring to about the sacred trust. He was an emaciated shell of a man at that point. And so anyway, I'm sure those were his last written words that you're referring to, the sacred trust.
Mm-hmm. Well, he also said, I believe, early to bed, early to rise, work like hell and advertise.
Yes. Anyway, they used to, his winter home, you used to be able to stay there. You could, I laid in the bed that he died in. I wore his hat. I sat in his chair. I read out of his library. It was awesome.
Yeah, I have not been down to Sarasota, but I did hear that Sid Williams has an adjacent property to BJ's.
Right, correct, right next door. And so it was Sid that bought the home when it became available, and then he restored it to the way it was when BJ lived there. It's very colorful because he liked the circus, and that's why he located in Sarasota. And so I was going to be speaking down in Florida at 2 different locations, and whoever was in charge of that, in charge of the home, I got a phone call, and she said, "We'd like you to stay here." And I said, "I'm going to be the other side of the state." And she goes, "No, I want you to stay here for free." So I told my wife, we went online, we looked at pictures of the place, and she's like, "Well, it looks a little weird, but if it's for free, it's for me." So we stayed a week in the home there, and it was great. It was a great time.
Yeah, and that's the thing about this profession. There's such a deep resonance with history, and there's so many great, colorful characters in this profession. And I guess that's how I want to open up with you. 1987, you finished up your chiropractic education. What inspired you to say, "Hey, I think I'm going to do this thing called chiropractic"?
So when I was 17, my parents ran away from home. That's actually kind of true. I found myself at 17 on my own. I needed to have a full-time job. I worked at the local grocery store. I have that in common with D.D. Palmer. I was a grocer. I injured my back. I had a wife at the time whose mother was a staunch chiropractic advocate. I was doing the medical treatment for this herniated disc that I had, which at that time consisted of bed rest and a heating pad. And 3 weeks later, I was way worse. And my mother-in-law said, "You're going to go see my chiropractor because my daughter's not going to be married to a cripple." And she made an appointment for me, and she dragged my sorry butt over to Dr. William Rademacher's office. And the rest is history. My leg pain resolved after about the 3rd treatment, and then after about a month, my back pain was, and I went back to work. And I was going to go back to college in the fall, and I knew that I had to be a chiropractor at that point. I had to find out what took place there when medical treatment had failed me, and I avoided a surgical intervention.
So talk to me a little bit about your introduction to Palmer and Davenport, Iowa. Like, I know you said did you grow up in Illinois then?
I'm originally from Michigan. My dad was a college professor. We kind of moved all over the Midwest. We lived in multiple places in Michigan, and in Champaign, where he got his master's degree, and then he taught at the University of Kansas, and then also at Michigan State University. And his last appointment was at Illinois Wesleyan University, that's here in town. He was chairman of their foreign language department. That's how I ended up being in Illinois. And then 2 weeks after I graduated from high school, he changed careers, went to work in the auto industry as a liaison between the Germans and the Americans at an assembly plant in Westmoreland County, Pennsylvania. And I knew I wasn't going to Westmoreland County, Pennsylvania, because I was essentially an adult. I really wasn't. I was 17, but I got a full-time job and got hurt, got fixed up by chiropractic. Bill Rademacher was a Palmer grad, brought me over to Palmer, said, "This is the only place for you to go." Went to Palmer, graduated in June of 1987, opened my practice in September of 1987. Practiced for 36 years and retired on December 13th of last year.
And I know that I have a lot of reverence for Palmer College. I think you do too. How do you think they're doing today?
Boy, that's a difficult question. I think that our profession suffers from an identity crisis,
Mhm.
and that identity crisis stems from all of the various things that are taught in chiropractic colleges, and it reduces a chiropractic adjustment to just one of the various modalities that a chiropractor might choose from to address a patient's problem. And so I'm not a big fan of the dilution of the importance of what we do in terms of adjusting patients' spines. It's the primary thing I did traction and exercise in my office as well, but those things. When I would speak at some seminars, people would say, "Oh, you're a mixer. You do traction." I go, "No, the traction that I do is aimed at reducing a global subluxation of, for example, the cervical spine when you do extension traction to restore that lordosis." And so I would say that's really an adjusting instrument. The difference is the force is applied over 10 to 20 minutes, rather a tenth of a second that it takes to do with your hands, or a hundredth of a second that it takes to do with an instrument, a handheld instrument. So
Well, I love that perspective, because I do think that chiropractic, whether somebody's going to a school I wouldn't refer students to or a school that I would refer students to, I think that primarily the thing that chiropractors need to have once they come out of their education process is the ability to adjust.
yeah, it's the primary thing that we do. I mean, if you don't have good motor skills, you're not going to be a very successful chiropractor, in my opinion, because it's still the number one thing that we do, and it needs to remain the number one thing that we do.
A freaking men.
Hmm.
Um, and chiropractic biophysics is something that we were talking about off camera about how I got into this profession. I was doing, honestly, this will probably like blow most people's minds. I was doing 500 traction setups a week. Like,
That's a lot.
show me somebody that was competent enough to do 10 of those a week. And then as the patients get better and you start seeing these improvements and you do those post x-rays, it was just as much of a mind opener for me as it was for them when you would show them a pre and post x-ray and you're like, this is you.
Yep, it's
So
pretty
I
powerful stuff.
I think that what you did for your career and working with the chiropractic biophysics technique and being a part of that community, I believe that that's like the higher caliber of chiropractor, to be honest with you. Like, I always believed that they were a superior breed of chiropractors, and those were the ones that were doing the research. Those were the ones that were doing pre and post x rays. Those were the ones that were actually changing people's lives by changing their spines. I was like, anybody can pop and pray and tell people that they're better, but are you actually objectively showing them that they're improving? Are you actually showing them that their body's changed at all, except for maybe some scans? So
Yep.
I've always appreciated chiropractic biophysics.
Well, that goes back to something else that we were talking about off screen in terms of reliability of the things that we do to assess a patient. I mean, plumb line posture analysis and measurements on X-ray are two of the most reliable things that a chiropractor can do in terms of assessment of their patient for the presence or absence of subluxation. Now you have to for me you have to define it in a very specific way. You put 100 chiropractors in a room, you might get 100 different definitions of what a subluxation is. But if you're a CBP leaning chiropractor, you have a very specific definition of what a subluxation is. And I liked measuring things. Uh, I'm a skeptical scientist, so I like the fact that there were measurements involved, and that you would uh, you would outline a program of care for a patient. You'd carry out that program of care, and then you would look at the results that you got. You had to put. It's a hard way to practice. You have to put your money where your mouth is, but it's a very rewarding way to practice. And I did it for 30, 35 of the 36 years that I practiced.
Yeah, I just think that's so valuable that, working with people, with them, not just on them. I think there's a big distinction between how involved a chiropractic biophysics practices, as opposed to somebody that's just coming in for the flying sevens, or they come in for, push on the high spots, and there you go. Or they might not even get an adjustment. Like, it's silly to me.
But it's not that those, how do I want to say this? So there's two things from research. We know there's two things about joint manipulation that we know for sure. It decreases pain and it increases range of motion. Those sound like good things to me in terms of patient outcomes. But you don't have to reduce a patient's postural displacements. That's a subluxation to me, a global subluxation. You don't have to do that in order to achieve increased range of motion and decrease pain. And so for me, uh, if that's all people wanted, I'm a low pressure. I was a low pressure salesman in practice. I had the short term care thing written out. I had the rehabilitative care thing written out on a piece of paper. I would go through the two options with them. I would hand them the sheet of paper and I'd say, I work for you. What do you want to do? And no matter what they chose, I pursued that, because people make choices for different reasons. Sometimes they might not choose the corrective care or the rehabilitative care option because they don't trust me. Sometimes they might not choose that because they think to themselves, oh, this is going to require more money. I don't have that money. They might say, I don't have the time to invest coming here 3 times a week I usually did 3 times a week for 8 to 10 weeks. And then we would reevaluate, post their x-rays and and redo their exam findings. So those things don't matter to me. Whatever their decision was, I would. So if they chose the short-term thing, and they would be in my office, and they'd be laying on one of my spinalators, because that was one of the last things. That was the last thing that I did with patients. And they would see patients come in and go to my exercise stations and start exercising, or they would hear the drop table making noise, and they'd say, they would say to me, how come you don't do that thing where the table is making all that noise? You just do the thing that makes the popping and clicking noises. And I would say to them, don't worry about that. That person wanted to fix their problem. And I'd walk away from them. And so I had 3 of these, intersegmental traction tables side by side, and patients would be laying there and they'd start talking to each other. And maybe one of the patients who had just chosen the short-term care thing would say, well, how come you're doing that instead of the short-term thing? And they might say, I did the short-term thing. And after the 4th round of short-term care, I said to Dr. Steve, hey, I just keep having the same problem over and over again. Is it too late for me to try and correct this problem as much as possible? And I'd say, no, it's not too late. We can do that now. But, it's 3 years later. You're 3 years older. Older people don't heal as fast as younger people. We can still do it. And then, it was their decision. I didn't force them into doing something they didn't want to do. So I was low pressure about all that. And you've kind of segued into something that I talk about from time to time. I don't like practice management companies. I like what you do. You're a marketer. You get people to the office. Then it's up to the doctor to figure out what to do with them after they're there. But I don't like practice management companies because they don't teach you how to take better care of a patient necessarily. They just teach you how to do the upsell to a patient. And I don't like that. I don't like the upsell. I like, give the patient options, let them make a choice, guide them from there. And some of those patients would say to me, how come you didn't, make me do the right thing? And I would say, oh, that's pretty simple. This is America. And in America, you have freedom to choose. Unfortunately, one of the choices can be failure. And I'm not your father. So I'll let you make your own decision. And I want to tell you, I had a great practice. I had a really stress-free practice because I wasn't hounding people to be there. They chose to be there.
You made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is brought to you by Excite Medical and the DRX 9000, Peach State Payments, Recover, Chiro HD, Softwave, Cool Blue BA, Chiro Health USA, Chiro Script AI, Chiro Moguls, The Chiro Speaking Company, Pure Chiro Notes, 5-Star Forge, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, and the IFCO. You can benefit from our full list of sponsors by visiting the sponsor page at chirohustle.com/sponsors. Links in the description. Now, let's hustle. Well, I love the truth that you offer up to our audience today, because I think that it's so valuable for people to tell people that they do have a choice. And, from the work that I've done, I don't know if I've ever told you this, but I just scheduled my 11,000th person into a chiropractic clinic since 2016. And
awesome.
I'll tell you, when people are dealing with me, they have like a high level sales guy. Okay. Cause I'm going out there and I'm here to save their lives. If I don't tell them the truth about chiropractic, someone else will close them from drugs or surgery. I tell that to them right in their face. And when people get to that last stage of like talking to me and they're hesitant or they don't take action with me, because I know that what I do works. It's like magic. I can talk to anybody for a matter of 3 to 5 minutes and they're saying yes, emphatically yes. And when somebody doesn't, I have a pause and I say, what's stopping you today? Time or money? And I let them tell the truth to me. And typically it's people don't want to commit. And I say, okay, it's fine. Here, take our card, call us when you're ready, because I know what we can do can help you, but you have to make that decision first. And if it's money, I say, hey, take our card. When things get better for you, just know that we're a viable resource for you, that we're here to help you, and that no one else is going to do what we do. So when you're ready, this is the most important card you'll ever get. Don't throw it away, and don't set it in a stack full of other cards to where it feels unimportant. Put it to the side, put it on your refrigerator. So every time you go to get inside your refrigerator, you know that you need to come see us. Cool. Here, take that.
Excellent.
And typically, Doc, I'll tell people this too. Like, I don't give cards. And they're like, why not? And I'll say, well, because our deal is so ridiculously affordable that everybody just wants to come and see us. And, I just think that we have to get better at how we communicate, like you were talking earlier. I do want to talk about your book too, The Human Touch. So if we get too down the line of talking about like patient care and, why we're still at belief and the belief in chiropractic, we can always get another interview going with you, because I do think there's a lot of value in discussing these topics with you. But the 8% is cultural authority. Talk about that a little bit.
So have you seen those memes where it's usually broken into 4 frames, and the first frame is what my friends think I do, and then there's a picture in there, and the second frame is what my mother thinks I do, and the third frame is what society thinks I do, and then the fourth frame is what I actually do.
Mm-hmm.
And so I was talking to some of my friends, and so I made up one of those memes, and in the first I was talking to some of my chiropractic friends, and in the first frame, I put a picture of Rambo breaking somebody's neck. So that's what my friends think I do, my non-chiropractic friends. And then the second frame, what my mother thinks I do, I showed Jesus laying his hands on a child and curing the child. And in the third frame, what society thinks I do, I put a picture of a book, and the title of the book is The Book of Spells, because a lot of people think what we do is voodoo or magic or something like that. And then the fourth frame, I showed a picture of me taking a patient's history, doing an adjustment, charting notes, that kind of stuff. And so it occurred to me that even my kids don't really know exactly what it is I do. So when I retired in December, I knew that I needed to stay out of my wife's hair. So I decided I would sit down and I would write a book that shows what a chiropractor actually does. And I did that through the use of clinical parables, stories out of my office of actual patients that demonstrate the depth and breadth of chiropractic training. So I have stories in there where, like a gentleman came into my office. He'd been in a really bad car accident. When I say a really bad car accident, he hit a semi head on and got ejected through the windshield. And he spent 8 weeks in the hospital. And he got to my office because he had residual neck pain. And a lot of chiropractors wouldn't have x-rayed that guy because he'd been 8 weeks in the hospital. He'd been scanned. And anyway, to make a very long story short, they missed a C1 burst fracture of the top bone in the neck. Got broken into 4 pieces. And I x-rayed him. I saw the fracture and I said, you have a fracture that they missed at the hospital. We need to transport you to the hospital. So transport him to the hospital. He asked me to ride in the ambulance with him because he was from Indianapolis. He didn't live in Normal. He just worked in Normal, Illinois, where I was. He didn't have any family. So I rode in the ambulance. And let me tell you, in those days, we were lepers. Chiropractors were lepers. So the ER physician walks up to me and he's like, what's going on here? And I explained to him what happened. And he goes, a C1 burst fracture. I'll be the judge of that. And he grabbed the x-ray jacket out of my hand and he put the films up and he's like, holy crap, that's a C1 burst fracture. And he turned around and looked at me and said, doctor, would you like to go to radiology and get an official read here? Now I'm kind of looking around because 5 minutes ago I couldn't get in that hospital as a patient, and now he's calling me doctor. So we go to radiology. The radiology looks at it and says, yep, that looks like a C1 burst fracture. He needs to have a CT scan. So the ER physician turns around, looks at me and says, doctor, would you like to watch the CT scan? And I was like, absolutely. So I'm watching as it comes across the viewing screen and it's busted into 4 parts. And he says to me, the ER physician says to me, you want to tell your patient? I was like, yeah, I should probably be the one to tell him. So I told him he had a fracture and that they were calling the local neurosurgeon to come over and examine him. And the ER physician says, Dr. Stroink is on the phone and would like to speak to you. She was the local neurosurgeon. And I'd never met her. And I came to the phone and she talked to me like she knew me. Oh, Steve, that was a great catch. Thank God you didn't manipulate that guy's neck. He'd be dead now. I'm going to be there in about 30 minutes to evaluate your patient. Could you stay? I'd like to meet you. And I rode over in the ambulance. I had no way to get home until somebody came and got me anyway. So I stuck around for another 30 minutes, met this neurosurgeon, and she's a good friend of mine now and has referred me lots of patients. I've referred patients to her who failed chiropractic treatment. It was the start of an in with the medical profession. I actually tell that story in the book. One of the things that I did was I discovered from my interactions with them that they just don't know anything about us. And everything that they were told was wrong. So I decided that I would do a newsletter series and I would send newsletters to all the medical doctors in my community. And I would address all of the common things that medical physicians objected to about chiropractic. And so I did that for 2 years. And I ended up, as a result of that, I ended up with a referral-only practice. And the referrals came almost entirely from medical doctors. And when those patients would show up, they would do anything I told them to do because the guy or gal with cultural authority, their medical doctor, told them they needed to be in my office. And so we need to have that kind of cultural authority. And I wrote this book to show the depth and breadth of what chiropractors do. It's written for lay people. I've had chiropractors read it and tell me every chiropractic student should read it. I've had at least a half a dozen nurses read it and tell me, some of them said, I had no idea a chiropractor did those kinds of things. My son read it and said, Dad, I didn't know until I read this book that you did the kinds of things that are in that book. So that was pretty eye-opening to me. Even your family doesn't know exactly what it is you do.
Mm-hmm. And listening to that story, I have to ask you, how did we fix C1?
So there's no adjustment for that. It's a fracture, so it's a surgical procedure. So part of C1 gets fused to the base of the skull, and the other part of C1 gets fused to the second cervical vertebra. And he went on to have surgery, and he appreciated the fact, he would credit me and say I saved his life. Say I didn't save your life. I just got you to the right people.
Yeah. And, in philosophy, when people talk about chiropractic and philosophy, when they don't know philosophy, there is something called limitations of matter.
Absolutely.
And when people have a severe injury like that, there's nothing going to adjust that away. Like you get what comes in as a case, you assess it the way you're supposed to. Like I tell everybody, when they come in, we're going to do a full exam. We're going to check you from tip to toe. We're going to find out what's going on. We're going to do orthopedic checks. We're going to do some muscle testing. We're going to shoot some x-rays. We're going to review those x-rays. We're going to tell you what's going on, how much concern there's. We're going to tell you how we can help you. If you like us, you think we're a good fit, stick with us. And I say that a million times, but I think it's so true that when a case comes in, you have to do those assessments. You have to do the orthopedic checks. You have to do the muscle testing. You have to do the nervous system scans. You have to do all the evaluations to see if it's okay to adjust people. So I think that you have to utilize all tools in the toolkit of diagnosis and then delivery. If you're not a good practitioner, you definitely have to work on your adjusting techniques to where you can deliver the goods. So it is very much a triune of health profession, science, philosophy, and art.
Mhm.
But you also have to understand that philosophy is written for a reason to understand it when it does apply to real life situations.
True that. So I'm a published researcher. My nature is to be skeptical. So I have some difficulties at times with some of the vitalistic concepts that I come across from people in chiropractic. But I also know that we can't measure everything. But I remember one time speaking at a seminar and somebody said to me, well, you can't measure innate. You can't measure the effect of universal intelligence. And I said, oh, well, actually you can. And they said, well, how do you do that? And I said, every study that has a placebo control, the patients that get better under the placebo, that's innate at work. I never called it innate in my practice. I would say Mother Nature. Medicine has a corollary. It's called vis medicatrix nurturae, which means the healing power of nature. And so if you look at a study and it has say a prospective randomized study where half the patients get a placebo and a certain number of those patients get better as a result of the placebo, that's their natural healing process. That's innate, or the healing power of nature, or Mother Nature, as I would have said to patients in my office. So you actually can kind of measure it.
And how I would tell people is the body needs nothing extra in it. It simply needs no interference. When it gets clear, the body self-regulates and self-heals. Have a good day now.
Exactly. There you go.
But that's my educated intelligence. So when I'm clear and I get regular care and people correct my subluxation, I get a chance to connect innate to universal to educated. And I think that when somebody has that fundamental knowledge base, like you do, when you ask why, when you're telling me earlier off camera, like the reason that, a lot of times you'd go to a seminar and you'd ask why over and over to get clarity. I know because I've been so much inside of this profession that some of the things I say and I know just is because I've been around so long that it's almost like osmosis inside of me. Like I've absorbed the truth of your profession because of the amount of conversations I've had on one simple topic, which isn't so simple. It's a big, broad topic, which is chiropractic.
Exactly. It is a big topic.
It is, but it is one word and it's very misconstrued. And I know that I didn't want to finish today's interview with you without talking about belief. Talk about the belief in chiropractic.
So many, many years ago, it was like 1995. I was asked to speak on it was locally here to be a member of a panel discussion, and it was about healthcare. And when the thing was over, actually before it started, a young man came up to me and, I introduced myself as a chiropractor, and he says, "Oh, chiropractic. I've been to a chiropractor before. I really believe in chiropractic." Well, I was distracted through the rest of the day because I thought to myself, I hate that, because belief is defined as trust in the absence of confirming evidence. And there's lots of evidence that shows that chiropractic is an effective healthcare intervention for, certainly there's a lot of evidence for neck pain, back pain, and headache. And there's a compelling amount of evidence for other disorders, but the results are unpredictable. So, but you don't get to believe in chiropractic. Chiropractic is a healthcare profession that's licensed in all 50 states and all around the world. You don't get to believe in chiropractic. And there's evidence that supports the effectiveness of chiropractic in select areas of healthcare. You get to believe in the Easter Bunny. You get to believe in Santa Claus, but you don't get to believe in chiropractic. And so when people would say to me, I really believe in chiropractic, I'd say, oh, good for you. I don't. And here's why I don't. Because it's not optional. You don't get to believe in chiropractic. In select areas of healthcare, it's proven, and it's an established chiropractic. It's an established healthcare profession. So you don't get to believe in it.
And philosophically, I didn't say this in my past interview that you listened to, but I do the drop the keys from Sid Williams on people. I say chiropractic's like gravity. It works whether you believe in it or not. You don't have to believe in it. Just get adjusted and then tell people how great you are progressing with whatever condition you came in with, and tell everyone about us when you have a good experience. And then I say, you're probably going to become our number one referral source. So just show up so we can help you. Okay. And I think that when you start to pre-frame all this for people, now they have like a safety and the responsibility of you saying something to them that you believe in. And when you have so much belief in your research and effectiveness and knowledge base, then people then say, okay, I'll send people to you because you are an authority in what you do and why you do it and who it's for. I think there's nothing greater than chiropractic when it can come to somebody that doesn't know what to do with their health or where to go or who to trust. Chiropractors innately, here back to innate, they just want to take care of more people.
Exactly.
And if you can be a solution for other practitioners to get good results, heck, just like your relationships with these medical professionals, they're going to send people to you because they're going to get better outcomes.
Exactly.
And if that's what it's all about, then hey, we all need to walk together now.
That's exactly correct. Exactly correct.
There's no debunking or proving anybody wrong when it's about the person in front of you.
Oh, look, in terms of these medical doctors, so I got myself invited to a forum where these medical physicians wanted to learn something about chiropractic. So they invited myself and two of my colleagues, and my colleagues talked about day-to-day practice, and they answered sort of the day-to-day questions. But any question that had a literature-based answer, I answered those questions. And so I would get a question from one of the medical doctors. Well, have you heard that chiropractic can cause strokes? And I would walk over to my 3-ring binder and I'd say, let's see what your literature says about that. And I would flip through my pages and I'd pull an article out of Spine or out of JMPT, and I would put it on the overhead projector and I'd say, here's an article out of Spine. And it shows that when you compare the risks of a chiropractic manipulation to non-steroidal anti-inflammatory drugs or to surgery, that in terms of anti-inflammatory drugs, chiropractic is 100 to 400 times safer than popping an aspirin in your mouth. And you don't think twice about telling patients to take those drugs every single day. And when it comes to surgery, 1 out of every 2,500 people that gets an anterior cervical discectomy infusion ends up dead. So we're way safer than that. Way safer than that. And so the medical profession, actually, in terms of their publications, if you go back into the early part of Index Medicus, there's a bunch of articles in there that support chiropractic as an intervention in select areas of healthcare. So I just kept showing them one article after another from their own literature. And at the end, this gentleman walks up to me. I was putting all my stuff away, and he sticks his hand out and he says, young man, because I was a young man then, he says, I owe you and your profession an apology. And I looked at him and I said, why do you owe me an apology? I've never met you before. He says, my name is Dr. Ed Pegg, and I'm a local neurologist. And I tell people every day that you guys are dangerous. And what you showed me with compelling and convincing evidence from my own literature that you're safe and I'm dangerous. And he referred me a patient the next day.
You know, the work that I do when I go out and do these community outreach events, Dr. Steve, people will say, I don't believe in chiropractic. And the guy that I work with the most, his name's Matt. Matt will say it's because you're taking advice from people selling you the other things. And,
True that.
you know, when all you have in your toolkit is a diagnosis with drugs or surgery, that's what you provide to people.
Exactly.
And that's what you mold them into, that framework of understanding. But with chiropractic, you're like, all right, great. You have a subluxation. We're going to adjust. We're going to restore your curve. We're going to work on your posture rehabilitation. And that's the toolkit we work with. And that's why I love chiropractic, because it is the largest healing art out there, drugless and women without surgery, that actually gets massive results for people, which gets people better faster. You know, and if I could coin chiropractic long term as a billboard slogan, chiropractic gets people better faster. And that if people only need one little like snippet of what chiropractic does, it gets people better faster. And it doesn't need pills, potions, or lotions, as I've learned.
Yep. And you're the marketing guy, so you know that the message needs to be simple and quick, and that's excellent.
And after you talk to a million people, I guarantee I've talked to over 1 million people. When you talk to people so frequently, you start to understand where their belief system comes from. And then you start to make friends with them and tell them, okay, I agree with you. And by the way, this is how we help you. Would you like this? Mm-hmm. Would you like to come see us? And then people are going to convert that much faster, because they don't want you to tell them that they're wrong. They want you to agree with them.
Absolutely.
And when you agree with them, you can steer them to go any direction you want.
True that. I agree with you.
By the way, do you want to come see us?
Well, you're a little far for me. I'll just keep going to the gal who took over my office.
Exactly. But Dr. Steve, I know that we've been at it now almost 40 minutes. Is there anything I didn't touch with you that you wanted to make sure we talked about today before we call it a day?
There's all kinds of stuff that you and I could talk about, but we'll have to do that in the future, because it sounds like you're out of time.
Well,
I'm definitely not out of conversation.
Well, we'll have to extend another invite for you to come on to another show, and we can talk about a handful of other topics and have some more fun. Is that okay?
That sounds good to me.
Well, Dr. Steve, thank you for being episode 667 of the Chiro Hustle Podcast.
Can I interject one thing?
Of course.
So I have a website.
Yeah, let's have it.
And my website is www.doctor, spelled out DOCTOR -steve.com. And part of my reason for bringing that up is if you're interested in my book, you can certainly find that there. However, all of the newsletters that I sent to the medical doctors, they're posted on that website. Now, the information that's there, it would need some updating. But if you click on the articles tab, it'll take you to all of those articles that I sent to those medical doctors, and it addresses all of the common misconceptions that medical doctors have about chiropractic. And that's what I used to educate my local medical community, and it helped me build a practice that was pretty much referral only from medical physicians in Bloomington, Normal, Illinois.
Well, your database is very important in anything that we do, from the patients that we take care of to the knowledge skills that we attain. So go to dr-steve.com and check out these articles that he wrote to connect with the medical professionals in his local community in Bloomington, Normal, Illinois. Dr. Steve, you are such a value to the chiropractic profession. I just really want to say thank you for spending some time with me today.
Well, thank you for having me. It was my genuine pleasure.
Well, with that said, I close out all the time by telling people you're just one story away. Keep hustling. I'll see you guys on the next episode. Bye for now.
Bye-bye.
See you, Steve.
Thank you.
Bye-bye.
That was fun.
Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.